Hi, I'm Jill Tackle, Mayor of the City of Napa, and you're watching the Mayor of the Town show. We film a new edition every month, and I bring in guests that help us understand what's happening in Napa and bring us up to date with what's happening with some local organizations. So I'm pleased here today to have Fernando and Rachel. And
Hi.
so welcome.
Thank you. Thank you for having us.
Yeah, this is kind of fun.
Yeah,
This is a first.
Yeah,
This
totally.
is my first on-location TV interview after 12 years of doing it in studio. Ralph came on as my new producer and says, let's do it out in the field. So you're
Great.
in my office.
Hey, this is a first for us too, so.
Yay,
We're
okay.
excited.
So this is kind of changing it up for 2016.
So,
That's exciting.
yeah, definitely.
So you said, how many sites do you have?
Right now, we're currently operating 9 sites. I believe it's 5. There's 1 site in Calistoga, 1 in San Helena, 1 in Napa, 1 in the county campus. We work with the county to provide services for people who visit the county offices. We opened 1 in Fairfield most recently, and we are looking at opening 1 in South Napa near the movie theater on Gasser Road, which is sort of why we're here today.
Okay, yeah, to talk about that.
Yeah,
And
yeah.
I know Rachel's been pretty involved in
Yeah,
that.
absolutely.
So, the population you're serving is blossoming.
Yeah, totally. We have about 34,000 patients approximately. And this year, I believe last year, 2015, we had almost 90,000 visits. So it's a huge part of the community. We serve 1 in 4 children in Napa County, 1 in 6 adults in Napa County. So we're definitely seeing a lot of traffic in our health centers, and it's growing every year. Our patient base is expected to grow. It's grown 650% over the past 15
Wow.
years, I believe, and by 2020, that number is expected to jump to 875%. So it's definitely increasing. I think the onset of the Affordable Care Act has definitely provided a lot of opportunity for folks to receive healthcare insurance. The only thing is that there's not enough providers. So more and more people are enrolling in programs for family nurse practitioners, nursing, physician assistants to help sort of expand the base of people who can provide care for someone at the primary care level. So it's definitely something we're actively working on recruiting more physicians, but this is relatively a rural community, so we're trying to make it as enticing as possible for providers to come to us, because when you come to a community health center, you really get a good grasp of what it means to work in community health, what are some of the ongoing public health issues at the community level, because you get folks who have no insurance, who have not been to the doctor, who are coming in sick of all types of different types of illnesses. And so as a physician, you really get to see everything you sort of learned about in medical school, right? Because it's right there in front of you, and you build these really great relationships with our patients. And some of these folks, they have nowhere else to go. So we want to make sure that they have access to competent, quality care in a beautiful place. You know, it doesn't have to be, oh, it's the clinic over there where you go where no one else can go. We want to be seen as the clinic people want to go to, because we provide not only great care, but a special relationship with our patients. And we really do everything we can to stay continuously improving. And it's something we work hard for every day.
So sounds like you've decided one of the things you need to do in order to service the Napa community is to have another facility.
Absolutely. We are experiencing some trouble as far as wait times, just because there's just not enough capacity to be able to see some of these people. So what we want to do is build a 3-story, 30,000 square foot facility in South Napa that will be able to take in a lot of that extra traffic that is coming to our health centers now, and see people a lot more quickly, and be able to provide a venue where physicians can, from around the country, can say, oh, wow, this looks like a really great place to work. The Napa Valley, you know, there's wine, there's great living, beautiful weather, which I think is a big selling point. And I really love it here. And like I said, this is my first time really being involved in Napa County, and it's a great place to raise a family. The weather's always nice. There's always events and all kinds of cool stuff going on here. So I really enjoy it, and I think physicians will enjoy it as well. So back to the new center. Sorry,
Yeah.
I digressed for a second. It will have it'll provide adult health. We're going to have a teaching kitchen. So when, for example,
It's great,
yeah,
because
yeah.
one of the issues when I see the survey on what our problems are around health,
Yeah.
it's obesity,
yeah, absolutely,
diabetes.
yeah, and that goes for almost the rest of the country. I mean, it's a huge problem everywhere, and we're trying to think outside of the box. If we can actually show people how to cook a nice, healthy meal for their families and really get them engaged in these types of programs, I think it really starts that change within them that really begins the process of changing their lifestyle and changing the way they eat and sharing that with their families, because a lot of people, they bring what they know, you know what I mean. A lot of people don't have the money or the resources or really the knowledge to figure out what is a healthy meal, how to cook it, where to buy the best ingredients, what are the differences between the ingredients organic as opposed to something that's not organic. So we're trying to educate as well, so it's a huge part of what we're doing. A vision center, we're going to have optometry, so Medi-Cal patients will actually have somewhere to go where they can, pick up glasses and get diagnostics and things like that. A dental center will be there. We are going to have a community space where people can share that community space to be able to do all that. There's also a walking path, the Napa Valley Wine Trail, that's a few steps away. So we're going to have classes where folks can join groups and just walk down the Napa Valley Wine Trail. Again,
Vine.
Yeah, I'm
Vine.
sorry. The Vine Trail, yeah. The Wine Trail.
We got the same.
Almost.
Yeah.
Yeah. So it's gonna be beautiful. I think that Napa's been waiting for something like this as far as healthcare goes. There's a new generation of younger Napans, I think, that are trying to create an identity within themselves, and this health center will help them do that. I like to think that the design is sort of Silicon Valley meets Napa Valley. It's a really beautiful building.
So a beautiful building is going to be expensive. I think I saw somewhere $30 million.
Yeah.
So Rachel, maybe you want to talk to us a bit about how you raise $30 million. How are you going about in a capital campaign to figure out exactly, how to engage the community to help you raise that money?
It's a great question. And I don't know that there's a single answer. For us, the $30 million is going to be split in two parts. We're going to finance $15 million of the cost for the new building, and we're going to raise $15 million. We're very lucky to have a solid financial standing and moving towards sustainability as a nonprofit year over year. So we have the ability to finance half of that, which is great for us and great for the community. The $15 million that we're raising, we're really looking for everyone in the community to be involved. And I think it's creating a unique opportunity for us to engage staff, patients, community members, and some of the longtime supporters that have made the organization possible for the last 44 years. So the Vintners will play, we hope, a large part in that and supporting the dollar goal in some part. We have just launched a crowdfunding campaign to engage our community members. So that part, we're really looking towards our staff and our patients to come together and contribute in a meaningful way to themselves towards the health center that is theirs. The idea of ownership and the idea of accountability, and that this Napa is a Napa Valley for all the people who live here, is really important to OLE Health, and it'll be really important to this new building. So the crowdfunding goal is $100,000. We have a tagline with that. If everyone gave $20, we could have the campaign done if we had 5,000 donations. Mm-hmm. So I think trying to put the actual fundraising in terms that feels accessible to everyone. I mean, the three of us sitting here may not have $1 million each to give, to contribute to that campaign. That doesn't mean that our $20 or $50 or $100 isn't meaningful. And that's really what we're going for. I mean, this is a community health center. OLE Health has a great history at being a neighborhood health center, and I think that's shown pretty well in the sustainability of the 8 locations that we have throughout the valley. So this new health center will be very much the same way. It's a big ticket price, $30 million. However, I think if you break it down into smaller pieces, everyone can contribute in a way that feels meaningful.
And the location.
Yes.
How did you come to the location around the Gasser properties?
That's right, and it's in big part to the thanks of the Gasser Foundation. The Gasser Foundation donated land we are incredibly grateful. The space is right off of Imola Avenue, behind where the movie theater is. You can see there's a lot of development happening over there. And I think there's two things that are really, really important for us. One is the generosity of the Gasser Foundation to recognize the value of a health center and partnering with OLE Health to fulfill that need. I think that speaks a lot to the quality of OLE Health as a community partner. And I think it also speaks to Gasser's insight in seeing that that is an area of large development. And so what we're seeing, and I know you're looking at this as well, and sort of development of new residential properties in that area, we recognize that that is going to be perfectly placed. Fernando referenced the Vine Trail. There's public transportation that goes all around there. And when you're looking at population projections for the area, that South Napa region is going to become more and more dense. So we have no doubt that our capacity at this new building, which is 15,000 new patients, will be well utilized. Yeah.
Well, I was showing a group of people. We had a meeting over at the Hampton Inn a few weeks ago from electeds from the North Bay, and normally I take them downtown. And we've eaten at La Toque and the Opera House, but this time we went to Hampton Inn and had it catered by Heritage Eats, and it was a wonderful experience for the guests, and they went around and said, wow, this is really a unique property because you've got movie theaters, you've got transitional housing, you've got a new hotel, you've got a gym, you've got a homeless shelter. Now we're going to have a clinic out there. Developmentally, things don't normally happen with this kind of a mixture, but because of the Gasser Foundation's belief in the community, they've been able to mix traditional commercial development with some lovely additions to the community social network.
It's such a good point that you make. I think that the Gasser Foundation is kind of somewhat uniquely positioned to think in a really intentional way about infrastructure development, and they've been able to do that in the South Napa area in a way that I don't see mirrored in many other communities. And then thankfully we have this very highly engaged community where people really care about Napa and they love it. And I think those two things come together really nicely in seeing that we have a community that will support that kind of development, and we have people that care enough to create that type of infrastructure.
The community.
I'm going to take this time to do just one shameless plug, if I can, to anyone out there who's watching. Please do visit us. Rachel Cusick, Fernando Diaz. I think that just like Fernando was talking about, our reach is around 34,000 patients. We are integrated across all kinds of communication channels, and we would love our community to come on board, show their support for us, and we would love to show support for our community. So if there's anything that people want to get involved in, if businesses want to sponsor OLE Health or sponsor one of our events, please do get in touch with us. We welcome community partnerships.
So, well, thank you for being willing to be interviewed and absolutely speaking eloquently.
Thank you for having us on. We appreciate it.
And I want to thank you for watching
you,
the Mayor of the Town show. Tune in again next month when I'll bring in new visitors and we'll learn more about what's happening in Napa.
Thank you, Jill.
You're welcome.
Bye.
Yeah, we can wave.